standing up here, 2 of us are at risk for developing cancer in our lifetime, which sounds like just a statistic, but for me it became very real when, as a member of a family of 5, both of my parents were diagnosed with cancer, so that statistic was very real. I'm a patient advisor at the local and at the provincial level, and basically, as someone who helped 2 people through their journey, a lot of needs were identified, a lot of gaps. Things felt siloed. We never knew what was coming next. There was a lot of fear, a lot of anxiety, because you don't know what's going to happen next. You never know what your next move is going to be. So having a tool similar to my cancer GPS would have greatly helped and reduced a lot of those fears and anxiety along the way.
So in addition to addressing the dire need that Mia has identified for patients and family and caregivers, what we're also trying to impact is an ineffective system that's leading to a lot of lost dollars from our system. Low patient satisfaction scores, but also physician and staff satisfaction. And essentially, we're not maximizing the health and well-being of our patients. The tool is a personalized navigation tool for cancer patients that's going to enable them to take ownership of their journey and monitor as and when at the points that they are. It's a simple and easy to use mobile web application that will be interfaced with existing systems to reduce what the patient actually has to do. Through customer discovery, we've identified the other 13 regional cancer programs like ourselves in the province of Ontario, and our end users would be the patient and family and caregivers. Now the neat thing is that this can also be scaled and commercialized to other hospitals and diseases. That's how adaptable the tool would be. Getting to market, we have 2 phases. Phase 1 would be taking this mock-up and developing a prototype with input from our end users. Monitoring, we would hope to pilot this at the Windsor Regional Cancer Centre with a small subset of patients to determine how effective it is. We would continuously monitor and evaluate and determine a cost benefit. Our ask here is political and government support for provincial scale-up. Essentially, this prototype development would be self-funded through operational dollars or government grant funding. Now, phase 2, the commercialization aspect, would require some investors to support the commercialization and implementation. Before you consider the tool, we will take a quick look at the demo of the tool that we've developed. Of course.
It's a demo.
Welcome to technology. Okay, well, we'll talk about the tool.
And we'll fix it while we're working on typical demo. Designing our web app, we designed the interface to be simple, personalized, and responsive and easy to use by the intended audience. Since it's a cancer journey web application, we designed it such that the focal point would be the milestones of that cancer journey for the patient and their caregivers. Furthermore, in order to achieve that goal, we are intending to use a data architecture, a state-of-the-art data architecture that would enable us to A, make use of the data to produce information, and B, provide a venue for healthcare professionals and academics along their journey of discovery. Cancer. Partners have pointed out earlier, this is a cancer journey GPS tool. So its audience is intended to be the patients and the caregivers, and hopefully in the very not too distant future, the physicians and so on. The user, when they come in, when they log into or browse to the web application, they'll see this login screen. They log in, and when they log in, the system will determine the role, whether they are the patients, the caregiver, or what have you. And based on that, it will customize the view that's intended for them. This particular view that we've mocked up this weekend has been for the patient. And since it's a cancer journey, our main focus is on the milestones for their cancer journey. So did they have chemo? When did they complete a certain milestone? When did they do this? When did they do that? And in addition to that, we have, in their view, we have the reminders and alerts that are pushed to them by their caregivers and hopefully the cancer care center. They have the to-do list, and they have their several other utility
So this proves one thing, that we are going live. This was not made up. This is real life. This happens all the time.
For anyone who's interested in taking a look at the tool, we'd certainly be able to do it on our
we produced a working mock-up, so
Yeah.
unfortunately it's a demo.
It's
So
a demo. It happened. Okay, judges. Questions?
So how are you going to make money?
The idea is not to make money. What we're trying to affect is patient satisfaction, which indirectly will translate into saved dollars. Currently, we're losing a lot of patients up the 401 going to London for their care, and we hope to retain those patients within our cancer center. The funding structure is changing in Canada so that it's following the actual patient, and the idea is to retain them. So the more we can provide in terms of emotional support and their needs, that directly will translate into dollars for us.
We've also been thinking about other opportunities, such as research institutions and universities, and using this patient data for studies. Also for educational purposes with healthcare providers and CME credits, this might be something that is used there as well.
So it's like value added in your cancer.
And furthermore, this infrastructure that we built can be adopted by other by healthcare providers in other fields such as cardiac care or diabetes or what have you, to adopt the same philosophy basically and infrastructure.